Let's now look at some of the muscles with Bonita, my little girlfriend. Okay? So the first muscle group that we want to look at are the knee extensors. So the knee extensors, when the knee is bent, they kick it out. So that muscle group is pretty much the quadricep muscle group in the front. As a common insertion, we talked about it being the tibial tuberosity, right here in the front. In terms of the origin, the rectus femoris will originate from the AIIS, anterior inferior iliac spine, and the vastus intermedius comes from the middle of the thigh, and the vastus lateralis comes from the lateral posterior side of the femur, vastus medialis from the lateral medial side of the femur. They all feed into the tibial tuberosity. When we look at knee flexion, we look at the hamstring muscles, and the hamstring muscles, for our purposes, pretty much they fit right into the ischial tuberosity. That's where they originate from. We have a lateral compartment, we have a medial compartment to those. The lateral compartment is the biceps femoris, so that's running right from in here, going into the head of the fibula, into the head of the fibula, as well as a little bit of the lateral condyle of the tibia. Runs from the ischial tuberosity to the lateral side. There's a short head and a long head to the biceps femoris. The short head we don't really see on the model very well, but it starts in about the middle, lower third of the posterior thigh, linea aspera area. Then in the medial compartment end, we have both a semitendinosus and a semimembranosus. There are two muscles, one runs on top of the other one, and they go from the ischial tuberosity into the proximal medial tibia. The semitendinosus lies on top of the semimembranosus, and it has a tendinous portion down in the distal end where it inserts, and that makes it nice and easy to recognize on the end. The next group we're looking at are the adductor muscles, and for the most part the adductor muscles, for all of it, but generally speaking, they attach to the ramus of the pubis. So we have a couple of different places here. For them we have the adductor brevis right here, we have the adductor magnus right here, we have the adductor longus right here. We also have the pectineus and the gracilis in this area. We have the pectineus right here, and we have the gracilis right in here. When we look at them in terms of their insertion, they come from this more medial place of the pubic ramus and feed into the posterior thigh, the linea aspera. The pectineus goes very high up, and then we have the adductor brevis after it, the adductor longus more inferior to that, and then underlying it is the adductor magnus that spans the entire length of the thigh. As a matter of fact, one insertion point is the adductor tubercle that we just mentioned. That's right down here. As a whole group, they will bring the thigh medially and adducted. If we want to see the insertion points of the different adductors, we have the pectineus right up here, we have the adductor brevis here, the adductor longus here, the adductor magnus is indicated here, but we know it also goes to this area down here, and the gracilis goes all the way to the tibia, the proximal medial tibia. There's the gluteus maximus as well as the tensor fascia lata. The gluteus maximus starts in the posterior superior iliac spine, PSIS, as well as the lateral portion of the sacrum. It feeds into what will become the iliotibial tract that goes all the way down to the lateral tib fib area. But it also inserts right into here at the linea aspera. When we look at the motions that the gluteus maximus does, the main motion is extension of the thigh. It also does a little bit of a lateral rotation of the thigh, as we can see that here. And it also helps a little bit the abduction of the thigh. The tensor fascia lata is a muscle that starts at the ASIS and goes into the iliotibial tract with the gluteus maximus. Its function is a little bit different though, because it starts more from a front area. So it does actually help flex the thigh slightly. It helps the way it's arranged. It helps medially rotate the thigh a little bit. And it also helps abduct, like the magnus helps abduct the thigh a little bit. Last but not least is one of my favorite muscles, and that is the Sartorius muscle. The origin point is right here, that red space here. And it feeds to the medial proximal tibia, and it inserts right in here. And when that muscle contracts, it does this motion. So that's quite vast. What it does, in terms of the femur, it flexes the femur, it laterally rotates the femur, and it abducts the femur as well. In terms of the tibia, it flexes the knee or the tibia, and it medially rotates it a little bit. It pulls on it a little bit. The tibia doesn't move much, but it has a little bit of give. Alright, on this cadaver we can nicely see the long Sartorius muscle stemming all the way from the anterior superior iliac spine down into the medial tibial end. When we move that a little bit away, we have a nice long rectus femoris. On the side here we can see the vastus medialis coming around, and on the outside, that's the vastus medialis, yes. And on the outside we have a picture of the vastus lateralis. Take the femoral artery and femoral vein right here. But then here we have a muscle that stands out, and that is actually the adductor longus. Above it right in here is the adductor brevis, and one higher is the pectineus muscle. This muscle we can see here is actually the iliacus coming right and inserting into the lesser trochanter. Then two muscles to have left here. One is the adductor magnus, that's underneath, that's really a bulky muscle in this guy. And the other one is the gracilis. We'll point out these muscles that we just talked about a little bit on the model. Rectus femoris, vastus lateralis, because it's on the pinky side, and then vastus medialis come right here. We have the Sartorius right here. As far as the adductors are concerned, it gets a little bit messy in here, so I'm not going to test from this, except it will be the adductor group. And then if you look in the posterior segment, we have the semitendinosus laying on top of the semimembranosus, and on the other side, the lateral side, we have the biceps femoris.